If I'm being honest, I'm freaking out a little bit. I just failed my glucose test 1 hour.
Hi Cora, I'm Dr. Shannon Clark. I am a double board certified ObGyn and maternal-fetal medicine specialist, and don't freak out. We're going to talk a little bit about your screening test that you failed, and I hate saying the word failed, but whatever, it is what it is. 179, I believe, on your 1 hour glucola that was done at 14 weeks. First thing you need to know is this: gestational diabetes is diagnosed after 20 weeks of pregnancy, typically between 24 and 28 weeks of pregnancy when that 1 hour glucola is done. If that is a high level, then that 3 hour confirmatory diagnostic test is done. So both need to be failed to be called a gestational diabetic. Now, some people are screened earlier in pregnancy at less than 20 weeks if they have risk factors for diabetes. And if they can do that in one of two ways. The first way is to do the 1 hour glucola like you did. You had a 179, so now they're going to want you to do the 3 hour. And if you have 2 or more elevated values on that one, then they will call you a pre-gestational diabetic. Why? Because if you fail that testing at less than 20 weeks, that is called pre-gestational, meaning you likely came into the pregnancy already having diabetes. And you will be managed as a pre-gestational diabetic rather than a gestational diabetic, which is diagnosed after 20 weeks. The second way they can screen you for a pre-gestational diabetes at less than 20 weeks is with a hemoglobin A1C. The levels of the hemoglobin A1C are not as affected in the first part of pregnancy. So if you do a hemoglobin A1C and it's greater than 6.5, then you will be considered a pre-gestational diabetic and be managed as such. So those are the two main ways to screen people for diabetes at less than 20 weeks. And if that testing is failed, then you're considered a pre-gestational diabetic, not gestational diabetic. That is only diagnosed after 20 weeks of pregnancy. And just so everybody else knows, hemoglobin A1C is not valid after that early part in pregnancy. So after 20 weeks, it's not as valid, and it has been standardized for screening for or diagnosing gestational diabetes. So that's why it's only used earlier in pregnancy. That's a whole nother video. Now, Cora, for you, the 1 hour glucola came back at 179. So now they're going to have you do the 3 hour glucola. If that comes back elevated as well, then you should take your sugars for 1 to 2 weeks fasting and 1 to 2 hours after breakfast, lunch, and dinner. They will look at all those sugars and determine based on what your levels are whether or not you need treatment. If you have enough levels that are elevated, it is recommended that insulin be prescribed. First line management, okay? Insulin. Now, another thing that could happen is you do your sugars for 1 to 2 weeks and none are elevated, okay? None. Doesn't mean you're not diabetic. It just means you don't need medication at that point in time. You still need to take your sugars, just as I said before, fasting first thing in the morning, after 1 to 2 hours after breakfast, lunch, and dinner for the rest of your pregnancy, because it's not uncommon for people to have okay blood sugars in that first part of pregnancy, and then they start to creep up and even require medication like with insulin. So keep taking those blood sugars even if those first 2 weeks are okay. Now, I know it's stressful. I'm not saying not to be stressed. Maybe I did say that, but try not to be too stressed because there's things we can do to manage it. And knowing that you have this, if it does come back that you do have it, is half the battle, because now we can manage it. Not we, you and your care team can manage it, do the appropriate surveillance for you and the rest of the pregnancy, and have a healthy outcome for both you and the baby. I would also ask that you get a nutrition referral to a nutritionist or dietitian to talk about dietary changes that you can make to help maintain a healthy level of your blood sugar. Also, make sure they check for your thyroid hormone levels to make sure that that's okay as well. I hope that answers your questions.